Hello guys, greetings of the day. Once again, it's your dentist friend Dr. Gaurav Gupta from Chikitsa Dental with another educational video in which I'll be telling you how to maintain good health of your dental implants. Dental implants are the ideal choice for replacement of missing tooth for many reasons, and one of the main reasons is that it's identical to your natural tooth structure in every function and form and are very good in strength. Implants are actually the exact replica of your natural tooth and can function exactly like them in almost every aspect. And the best thing is, if you take good care of your dental implants, it can last up to ages and maybe for the lifetime also. Guys, you people spend a lot of money and precious time on dental implants treatment. So if you have invested so much on this treatment, isn't it advisable to invest some time for its maintenance also? There are just few regimes which you have to follow for the healthy life of dental implants. When caring for dental implants, it's important to maintain healthy gum tissues and supporting bone. Due to absence of natural tooth structure, it's impossible for implant itself to get decayed or develop a cavity. However, the life of implant can be affected in case of implantitis. Implantitis is basically a destructive inflammatory process affecting the soft and hard tissue surrounding the dental implants. During implantitis, the dental implants can become colonized by some dump of destructive bacteria that leads to soft deposition, which we call the plaque. And this plaque gradually leads to formation of calculus. Because of continuous deposition of calculus, it destroys the supporting gums and bone that ultimately leads to failure of dental implants. There are some simple home care recommendation for good maintenance of implant. First is proper toothbrush and mouthwashes. Electric toothbrush have been shown to disrupt biofilm better than manual brush due to the ability to generate more brush strokes than the mechanical toothbrush. And with regular use of mouthwash, we can maintain the cleanliness of the surface where toothbrush is not able to reach. Then there are interproximal aids to clean in between surface of tooth. Interdental flossing by floss sticks and water picks are advised. Floss sticks are a manual way of cleaning the in between areas of the teeth, whereas water pick are electromagnetic floss which cleanses the interproximal surface of the tooth by continuous water flow coming out of the pick at certain pressure, which helps in reducing the biofilm formed between the tooth surfaces. Another important thing is your regular visit to your dentist. Visit your dentist every 6 months. Routine professional maintenance is important to maintain dental implant health and ensuring longevity. The dentist play an integral role in determining what professional maintenance schedule is better suited for the patient based on the implant processes and overall health. So guys, my advice for today is that it's important to remember that dental implants are a large investment in oral health, and to properly maintain that investment, the patient will be required to spend more time on their home care as well as frequent maintenance visits. Goodbye guys, eat healthy, stay healthy, and take very good care of yourself. And thanks a lot for listening to me.